The ambulance is run on donations. Nobody funds it. Government don't fund it. The lottery doesn't fund it. The paramedics call it out. If there's been an accident or a road accident, then they're called out for that.
Airlifted helicopter to a burns hospital. If broken bones, they'll go to a broken bones specialist. They'll get the best healthcare possible instantly.
From here to go to our nearest hospital is 25 miles. With the air ambulance, it's 6 minutes. Oh, here's my 50,000 thing up there. This week it's up to 60,000. Most of the office workers are voluntary workers as well. They go in and do a day, like Ruthie Carter, she does a day, and her husband does the next day, and they work in the offices all day. And I've got 16 ladies that work 2-hour shifts part-time, and we're all voluntary, nobody gets paid.
The NHS started when I was about 3, I think, and in that time I've had all sorts of inoculations. I don't intend to get smallpox because they got rid of that, or TB, or all sorts of things that I had in the way of inoculations. I've had my tonsils out, had my appendix out. I've had 3 children where they looked after me before I had the children, they looked after me after I had the children. I've had various other bits and pieces. Just recently I had chest pains and I've had an angiogram, and I'm being treated now with medication for angina. And during that time, of course, my children have been looked after as well. They've had their inoculations against measles, mumps, rubella, all the various things. They've had whooping cough. They've had all of these inoculations. They've been treated when they have been ill. They have been looked after beautifully throughout the whole of their lives. And my oldest child is 40 and is doing all right. They are healthy, fit children. There are things wrong with it. And as I said earlier, I've had bad experience with it, but overall, I want to keep it.
It does deliver to majority of patients, which is in primary care. It is true that in the secondary care, that means secondary care is the hospital services, there is a capacity issue that we are not able to provide instant access to surgery for routine cases. All emergency cases are seen instantly and provided in CME. We have an excellent service for that. But routine cases do have to be seen and they have to take in turn according to the capacity.
I've had cancer, I've had heart attack, mainly through the work I did, and now I'm a diabetic, and quite frankly I've always been treated with great care.
I suffer with asthma as well, and I had an attack at the beginning of the year, in the winter period, which is the worst period for me. And within 5 minutes, I have a car with an ambulance man in there that gives me the breathing. Within 10 minutes, I have an ambulance that takes me to the hospital. I'm back in my own home. They run me back from the hospital, just me in the ambulance, back in my own home. I'm back in my own home within an hour. Having seen a doctor, having had an X-ray, and that.
No, we're all happy, aren't we, Molly?
The last 3 years, the National Health in England has been wonderful to me. I've had 2 lots of skin cancer. I've had chest X-rays. I had both my children in hospital. It was absolutely nothing.
If in this country, if you've got the power to live, you're allowed to live. I mean, I'm 82. I don't want to die yet.
No.
So I'm being looked after well.
Talking about rationing in NHS, I will put it just the other way around. America is much more rationed what you get. It is according to what you pay into the system. That means your type of insurance you have, limit to you what you can access. And in any private sector throughout the world, that is the way things are, that there is limitation in rationing according to how much you can pay into the system. So the more you pay the more choice you have. It's not based on need.
But there's a hell of a lot more poor people over there than you've got here. And even the poorest people here get a lot of benefits.
A couple of years ago when I went on holiday, just for a weekend, but I forgot my medication. So I had a prescription with me, so I knew what the proper names for the various things were, and I take four pills a day. So I went to the chemist and said, I can sell them to you, but I have to charge you the commercial cost. Oh, fine, that's okay, you know. I only wanted one of each, you know, just to last for one day, and for 4 pills, the commercial cost was £16. I thought, you know, that really brought it home to me, because I sort of chuck these back and then I have that every day, 365 days a year, and I've had it for nearly 30 years, you know, so that alone is quite a stupendous amount of money.
And you don't pay anything?
Which I don't pay.
Can I tell you about our friend who will be 93 on Saturday? She is going deaf. She has real problems with her hearing. She's also losing her sight. She has macular degeneration. She has her hearing aids through the NHS. She has them changed when she feels uncomfortable with them. If they buzz, she goes back, she has them changed. Her sight, they've got a new treatment now for macular degeneration, and she has been offered it.
He was a funny little man. He called out Mrs. Britland, and he had a funny old shirt on and big braces, and I thought he was one of the orderlies, you know. So we followed him, and he was a doctor, and he was absolutely marvellous. And he said this new treatment was for an injection in the eye. So I said, well, will I see any better? And he said, well, yeah, I can't guarantee you that, but it won't go any worse. So anyway, I said, I'm over 92, so he said, doesn't matter how old you are. He said, you're entitled to it.
Each time she's gone, she has said things like, oh, you don't want to be bothered with me at my age. And they have said, yes, we do. You need your sight. You need your sight to stay independent. You need your sight to help you live a normal life. So we will do what we can for you to keep your sight. 93. She is not being put down. She's not being shut up.